As I said before, that the different areas of the brain functions differently. In this video, we are going to discuss about the different lobes of the brain and its functions. Myself, Abhishek Pattanaik, I am an occupational therapist working here at Kanlon Rehabilitation Center. So coming to the topic, so basically there are four lobes in our brain. First is the frontal lobe, which is exactly behind the forehead. Second is the parietal lobe. Third is the temporal lobe, and fourth is the occipital lobe. So coming to the frontal lobe, this is the largest lobe of the brain which is situated exactly behind our forehead, which is primarily responsible for the memory, thinking, judgment, executive function, emotion and planning. Coming to the second, which is the parietal lobe, which is primarily responsible for the sensory perception and integration. This is the area where all the senses are processed and integrated, that coming from the different areas of the body. Third is the temporal lobe. There are primarily three structures which impacts a lot during stroke. That is Wernicke's area, Broca's area and limbic system. Primarily the dominant temporal lobe, which is the left temporal lobe, responsible for the learning and remembering the information related to the verbal information. And non-dominant temporal lobe, which is the right temporal lobe, is primarily responsible for learning and remembering the non-verbal information. And the last and fourth one is the occipital lobe. This is the area which is responsible for visual processing. So this is like the function of the occipital lobe is primarily vision and vision related things. So these are four lobes and their functions. And when a patient gets brain injury or stroke or anything related to brain, they will get the symptoms according to the area of the involvement of the brain. If the frontal lobe is involved, they will get the features like cognitive issues, behavioral issues, issues in social appropriateness, and so on. Like that, if the person is having difficulty in person is having difficulty in vision or vision related things, then you can consider that the parietal lobe is in. So it is important to know the brain, its parts and its functions before knowing the stroke in details. So in our upcoming video, I am going to discuss about neurorehabilitation.